Okay, good afternoon, everyone. I'm Maggie Bomber. I'm a member of AOPA's Committee for Access, Representation, and Empowerment, otherwise known as the CARE Committee. And the goal of the committee is to recognize all differences brought to AOPA and more broadly O&P to create a culture where we all feel that they matter, are respected, and belong. The committee also shares resources for professional and personal growth. So today I'm excited to welcome you to the CARES Committee's latest fireside chat, Advocacy in Action, Finding Your Voice in O&P Early. I will serve as the moderator of today's discussion. And during the next hour, the conversation will demystify advocacy and show you that it isn't limited to visits to Capitol Hill. You will learn about the many avenues for engagement, including federal and state advocacy, state associations, insurance and payer issues, and initiatives such as the So Everybody Can Move and What is POP initiative. Our panelists will discuss why advocacy matters, how it impacts patient access and professional practice, and why getting involved early can help shape both the future of the profession and your own career path. The discussion will also address one of the biggest barriers to participation, which is intimidation. If you've ever wondered whether you have enough experience, knowledge, or influence to make a difference, then this session is for you. You'll hear firsthand how advocacy skills can be developed over time and how participation can strengthen the communication, leadership, networking, and professional confidence. With that, let's get started. I'm going to ask each of our panelists to take a minute to introduce themselves before answering the first question. So to talk about some of the different ways O&P professionals advocate, how did you specifically get into advocacy? So I'm going to start us off and then I'll kick it over to the other panelists. So for me, advocacy really started before I got involved in the O&P space, in the O&P profession. As many of you know, I am also a person with limb loss. I'm missing my arm below the elbow as a result of a traumatic injury that I experienced back in 2012. But before that, I had been working in mental health. So I was a psychology major in college. And my first job after college was on an inpatient psychiatric unit of a hospital. So in that role, I served as a mental health counselor. And my job was really to meet with a list of clients every day, go through their treatment plan, and really to advocate for them in terms of what their needs were within the hospital system and helping them figure out where they were going to go after that stay. So I had a good amount of advocacy experience through that position, which I worked in for about 2 years. And then I started thinking more broadly of like, is this the path I want to stay on for the rest of my career? I knew that my main kind of driving force was to help other people, but I wasn't sure that the mental health space specifically was where I wanted to focus. So that's when I started thinking about law school because I knew several people, including my sister-in-law, who was enrolled in law school or working as a lawyer. And I thought, okay, that's another way of helping people and advocating for people. That's a little bit different than the mental health space where I was feeling a good amount of burnout only 2 years in. And so before I had my injury, I went through law school. I had a concentration in health law and worked at the Long-Term Care Community Coalition, which is a nonprofit advocacy group in New York City, for one of my summers between law school years. And then the second year, I actually worked at the Attorney General's office in New York in the Healthcare Bureau. So I learned a lot more about advocacy then. Specifically, my big project was advocating for Medicare patients who had been kind of targeted by these unscrupulous dental groups and who were charging them a lot for like a full mouth of new teeth that they didn't need. And so we worked with the Attorney General to go around and meet with these constituents and talk to them and do media interviews and try to crack down on that whole policy. So that was a good foray for me into the advocacy space and a good foundation for what I ended up doing later in O&P. And then, I had my own injury. My whole world got turned upside down. I kind of revamped my whole life and trajectory of what am I doing? Where am I going? What is going to bring me the most purpose? And that's when I started meeting people in the O&P field, which I know many of you can relate to. This field is so welcoming, and I think everybody has the same motivation that I spoke about earlier of wanting to help others. And so it just felt like a really natural and welcoming fit. And so my start in O&P was really at Hanger in a business development role where I kind of learned the whole industry from the ground up, did a lot of advocating for patients through, I started running a support group and doing peer-to-peer visits. And then, from there, I moved into a clinic management role. And all the while, I had been serving on some boards. So the American Trauma Society board, and eventually the National Association for the Advancement of Orthotics and Prosthetics. So that's where I got to learn a whole lot more about advocacy in the O&P space specifically, which was exciting. And then finally, just about 2.5, 3 years ago, probably about 3 years ago, I proposed to my boss at Hanger that we create a role in a department that's specifically dedicated to advocacy. And he had served on the AOPA board for many years. And so he certainly knew the value of advocacy firsthand. And so, it took a little while, and as things go, there's a process to creating a whole new position and department. And so there were some logistics to figure out. But eventually that came to be. And now I've been serving in this role at Hanger, the leader of enterprise patient advocacy, for about 2.5 years now. And my key focuses through that role have been on the So Everybody Can Move initiative, which I'm sure many of you know is designed to increase access to care for devices for physical activity, as well as to work on Medicaid coverage and reimbursement policies across the country to ensure that we're really having adequate access to care for people through those programs. Um, so that's my story. That's kind of how I got involved in advocacy. It started way before O&P and kind of naturally has grown and blossomed and become bigger and bigger. And that is my hope for many of you as well, is that we plant a seed today of what's possible within advocacy. And then, that seed can grow. And I know the other panelists have similar stories. So I will go ahead and kick it over to you all now. Maybe we could start with Kyle.
Awesome. Thank you so much, Maggie. And hi, everyone, for joining us. My name is Kyle Stepp, and I'm calling in from Albuquerque, New Mexico, and have the privilege of serving as one of the national leads for So Everybody Can Move. And when I think about my journey to advocacy, it started from the lived experience. I think every single one of us on this call don't realize that we're inherent advocates through our own journeys of self-advocacy. And I think when it really started was really being able to self-advocate for what I needed as a kid. So many of us don't realize when we advocate for things we want in life or in school or opportunities, or we may unfortunately have to navigate whether it's a life-threatening illness or an injury, we often have to navigate self-advocacy for ourselves. And so my journey was the unconventional, being able to advocate for what I needed through treatment when I was diagnosed with osteosarcoma when I was 14. And I don't think any of us are ever prepared for an illness or injury. But often when we do, we have to learn how to navigate this system sometimes it's not designed for our best outcome. And early on as a kid, I had to learn how to advocate for the treatments I needed, being able to advocate for what I needed to go back to school after being diagnosed with osteosarcoma. But early on, it's when I started falling in my love for raising awareness for critical issues. When I went through treatment for osteosarcoma, my 9 best friends I went through treatment with didn't make it. And that's a reality that so many others go through. And, when I survived, I kept questioning why. My advocacy came from, why did I make it and not someone else? And that's when I quickly learned around the lack of research for childhood cancer and said, hey, my advocacy just started with like, I want to help. I don't know how, I don't know what to do, but I really just want to help because this isn't fair that I made it and they didn't. And I got invited to an awareness day at the state capitol in New Mexico for Childhood Cancer Awareness Day. And that was my first opportunity where I got to meet with legislators and educate them on less than 4% of the entire NIH budget went to childhood cancer research. And, that was my first introduction to when you meet with individuals that have the opportunity to influence change, our personal experiences, whether I went right alongside my doctors and nurses. My doctors and nurses were saying, like, hey, we would love that we can provide better treatments, but the treatments are outdated. The research is limited. And that was my first introduction to you can influence change. And I went on to DC to support the STAR Act, which was the largest investment in childhood cancer research, and was signed into law by President Biden. And the craziest part was we started that journey in 2012 and wouldn't get signed into law for almost 10 years. And just learning to honor that advocacy is the long road. And sometimes advocacy starts just by raising your hand and say, hey, I want to get involved. And so I would spend about 10 years in childhood cancer advocacy and nonprofit partnerships. Also, my role in advocacy at my university as a student government leader. But I'd eventually be introduced to O&P advocacy after I had my left leg amputated above the knee. And my advocacy in that journey started again with self advocacy. I received that denial letter that so many individuals with limb loss and limb difference and disabilities receive, where it just said the artificial leg that you've requested exceeded your basic and minimum needs. And went through 6 denials. And I'm like, this doesn't make sense. I'm really frustrated. And I knew there had to be a way. And very similar, Maggie and I have in common taking our self advocacy all the way to the superintendent of insurance in our state and having them overturn it. And our voice being able to advocate for that, that would eventually lead me into getting involved in So Everybody Can Move, which we'll share about a little bit more in a bit. But yeah, that's my journey to self advocacy and advocacy as a whole.
Thanks so much, Kyle. Every time you tell your story, it's so impactful. And so, even though I've heard it, it gets me every time. So, thank you so much for sharing that. Adrian, how about you?
All right, excellent. Hello, everyone. My name is Adrienne Hill, and I am a certified prosthetist orthotist by training. I've been in the field of O&P and certified since 2007. So I am kind of on the clinician side of this advocacy, which I used to call just awareness because I didn't know what it really entailed. And worked for Hanger Clinic prior to coming into education, and that is where I am now. I am the program director for Kennesaw State University's Masters of Science in Prosthetics and Orthotics, a little bit outside of Atlanta, Georgia. And I really, I guess I want to kind of start of it and call it awareness. And so my kind of ask or what I'll be talking about here on this panel will be kind of circled around what is pop. Because that has always been kind of my love, making everyone aware of this wonderful profession of orthotics and prosthetics and all that it really can bring to you. So if it is something small, just going to your community HOA meeting to talk about the field of orthotics and prosthetics, if it is the awareness of learning about this such small, tiny profession. And sometimes because everybody, unless it has kind of impacted you, you may not have known about the profession. And so starting small and looking at things in that way. And so for me, I was one of those. My grandfather was a bilateral above knee amputee. He wore stubbies in the house. And so my whole family is 6 feet and taller, if you've ever seen or any pictures of my family. And so he was the only person that I kind of saw eye to eye with when I was younger. And so then he put on Grandpa's Magic Legs and take me out to the movies, out to the park. There was a place called Discovery Zone, which is kind of like Chuck E. Cheese back in the day. And so I was like, yeah, everybody needs to be aware of these magic legs. Like you just pop them on and you just go. And so that was my first kind of introduction into the field. And so I took my grandpa's legs to show and tell. I took grandpa's legs everywhere. And he was like, Adrian, where did you take my legs? I have to go to work. Like, and so that was my first introduction to awareness, which I then now realize is real true advocacy for our patients, our clinicians, and our profession as a whole. And so I guess that is kind of my own introduction into the field, going to become a clinician and now teaching the next generation coming into the field. And so I really want to um, make everyone aware on how you can be impactful in advocacy, even on small level, all in small ways.
Love that. Thanks, Adrienne. And I'd love to hear how your journey too from, you know, that experience early on in your life to becoming a clinician and serving as a clinician for many years and now teaching and sharing with the next group of people coming up. It's really an awesome pathway and advocacy at all levels in different kinds of ways. So thank you so much. Brittany.
Yeah, thanks so much, Maggie. So my name is Brittany Gonzalez. I am also a certified prosthetist orthotist. I graduated from O&P school back in 2015. So I've been in the industry for about 11 years now. And I started working in a private practice in Southern California. I worked there for 8 years, and now I'm currently working at OSER as the reimbursement manager. And so my pathway with advocacy is a little bit different. I got into the industry, like I'm sure most of you did, just wanting to help patients live better, fuller lives. And, the first 5 years, that's what I was doing. I was a clinician, I was seeing patients, and I loved it. And over time, I started to get frustrated with reimbursement and how low reimbursement rates were and denials coming in for my patients who I knew deserved devices. And it really started to frustrate me. So I started looking into other pathways. I had some colleagues who recommended that I look into joining some committees. So my advocacy started pretty small with just, hey, I'll volunteer on a committee here and there and see what I can do. And my early experiences, I remember sitting on those calls being like, I don't belong here. I don't know much of what they're talking about. But I kept attending them. I kept going to them. And now, in my role here at OSER as reimbursement manager, my job is surrounded around advocating for better reimbursement and for these patients in a different way than what I was doing when I was in clinic. But my story really is revolved around I found kind of my niche, what I was passionate about, which was advocating for fair reimbursement and getting patients what they need when they need it. And it ultimately led me into the position I'm at today and the job I'm at today. And I think with advocacy, as we're going to talk about throughout the panel discussion, it's a long process. It's not easy. And so it's really important that you find what you're passionate about and let that drive your advocacy efforts.
Awesome. Yeah, thanks, Brittany. And actually, I might stay on you for a moment just for the next question, which has to do with what the tools are available to practice your advocacy skills. And I think you were going to touch on federal advocacy in particular. So would love to hear what you have to say about that.
Yeah, so as I mentioned before, I've gotten involved in a lot of committees. So the first ones I started with were actually AOPA committees. So this care committee was one of the first ones that I got involved with when I was a practitioner. And then I also got involved with the coding and reimbursement committee. And that kind of sparked my interest really in what was going on in the world reimbursement wise. And then over time, once I transitioned to OSER and got more involved in it, I actually joined some councils for the DME Max, which is Medicare. And so I now joined quarterly calls where the medical directors from Medicare are on the call listening to advocates out in the industry, telling them, hey, we're having issues with this policy, or there's questions in the industry. We're getting a lot of denials, a lot of audits, and we're able to go back and forth and kind of figure things out and then go back into the industry and say, okay, here's what we've learned from the DME Max, from the medical directors, and advocate for our patients and providers on the back end. And then most recently, AOPA started a new committee called the Private Payer Relations Committee, and Maggie's on that committee with myself and several others. And what we are doing now is focusing on private payers and issues that the industry is having and trying to, again, advocate for patients, advocate for providers, and saying, hey, this policy needs to be updated. There's either an error in it or we're getting incorrect denials over and over again. So we need to reach out and try and advocate and get this fixed. And we've had a lot of success very early on with reaching out to some of these private payers. And I will mention briefly, when I was in school and even the first several years of my career, advocacy wasn't really talked about. And it's so exciting right now. I know So Everybody Can Move, we're going to talk a lot about that. There's so much energy around the advocacy work. And not only with So Everybody Can Move, but on my end with reimbursement and collaborating and trying to talk to these payers. This is something that was not discussed when I was in school. Early on in my career, it wasn't really something that we did. We kind of just took our contracts and saw patients and moved on. So I feel like it's a really exciting time right now in the industry where things are changing, and there's a lot of opportunity for advocacy in a lot of different ways that we're going to lay out for you today. So hopefully you're able to take some of that and take it home and figure out where you fit in.
Perfect. Thank you so much. Yeah, it's great to think about advocacy big picture and then kind of whittle it down to the local level as well. So I know we're going to talk about, you spoke about the DME Max and how things kind of work from the Medicare perspective, larger commercial payers perspective, and how folks can get involved that way. So again, reaching out to AOPA committees, maybe attending the AOPA policy forum are good ways to get involved on that level. And then I wanted to segue over to you, Kyle, to talk a little bit about So Everybody Can Move. As Brittany mentioned, I think So Everybody Can Move has really spurred a lot of energy and enthusiasm around advocacy in the O&P space and the broader disability space. And so if you could speak a little about that, that would be great.
Yeah, absolutely. Maggie, I think one of the things that as Brittany was describing, all of these, I think something today you're going to hear about is all of these like systems that we live within. So whether that is the insurance system, that could be within Medicaid, that could be within the continuum of care system. There's all of these systems that we live within, or work within to provide the best care possible. Whether that is insurance barriers, that is the actual connections in the community. And one of the things I've learned recently is I don't think these systems were intentionally designed with our voices involved. And I think unfortunately for decades and decades and decades, we've often not involved our voices to connect with those people that are designing it. When I think about the insurance policies, I'll be honest with you, I don't think the individuals that are writing the policies are bad people. I think they're just misinformed and they're miseducated. I think about those that are serving in the Department of Medicaid may not fully understand the reimbursement system and how it negatively impacts the clinics. And our lived experience, both the lived experience as a person that is impacted by the negative policy from the Bears Access as an amputee, all the way to the clinician says, I know that I can provide this care to an individual for them to return back to sport, to return back to showering and safely, to return back to work. But there's a policy in place that's written that's preventing them from having that access. And what advocacy does is it educates them. It allows them to help them understand the policy that they written and the system that they designed actually has negative implications. And we get to actually help influence that change. And I'll tell you, majority of the time, when they sit across from a clinician, they sit across from a person with a lived experience, and they understand what has been designed is not providing people to restore back their function or to live an independent full life. They want to do something, but at the end of the day, they don't know that it's a problem until we educate them. And I think that's really where So Everybody Can Move has become so effective is in the United States, insurance is regulated both on the federal level and both on the state level. And so just depending on your health plan, and what you're able to do is actually pass state-based laws to impact 48% of individuals that are under a state regulated plan But then you eventually have to pass federal laws to impact those that are under federally regulated plans. And I always joke, I think there's a reason why so many advocacy groups have never wanted to take on insurance reform because technically you have to run a 50 state campaign plus a federal initiative. But what's the coolest thing about the O&P community and the disability community? We're everywhere. We're in all of the local communities. And we have the opportunity to come together to change our laws. And so when So Everybody Can Move started, there was an amazing young woman named Jordan Simpson that was inspired by Nicole Verkeilen, who's one of our national campaign leads, to advocate to change their state law to require insurance to cover prosthetics only for kids and to require for coverage for physical activity. And we learned, wow, okay, this lived experience alongside her care team educated the lawmakers that this was a problem because 90% of them don't even know it's a problem. Because, they don't realize that insurance doesn't cover more than one device. And when we got that first law passed, there was a group of us in New Mexico, Colorado, Illinois, and Arkansas and said, "Hey, we just want to help. That's all we want to do. We want to figure this out." And what we've learned is there's a power behind the lived experience voice right alongside their clinician because I can describe to them the challenges and barriers that I have. What can I not do as a person living with limb loss without access to more than one device? And my own lived experience, but then also the clinician can really dive into the biomechanics of why does someone need more than one device, understanding the challenges of the reimbursement system and the insurance coverage system, and that combined information is what really equips and educates the lawmaker on why they need to change the law. And so our movement is all around enacting legislation in 28 states by the Los Angeles 28 Paralympics. What started as a campaign for access to physical activities become a campaign that's completely revolutionizing medical necessity and revolutionizing patient care access through requiring state regulated health plans to cover more than one device for activities of daily living, physical activity, showering and bathing, and often job related purposes. But really, the intent is that our health plans provide the coverage to restore full function. And so I've
Mhm.
seen clinicians that they started just by saying, "Hey, I'm just going to raise my hand and I just want to come and listen." Then they say, "Hey, I just want to go to a meeting with the legislator and share with them why my patient needs access to this care." Then I see the clinician saying, "Hey, can I actually come to a hearing and testify?" And they take that next level and say, "Hey, I'm ready. I think I'm ready to testify in a hearing," all the way to now educating their peers on advocacy. But where it just starts is by not having the expertise, but you learn by doing.
Yeah, thanks, Kyle. You said so much there, and it's so inspiring to see like that we're really changing the way people are thinking about access to care for orthotics and prosthetics and the disability community as a whole. Like you said, the policies that exist currently are discriminatory, whether that was intentional or not, but they don't allow for people to access their full function without an additional device for physical activity. And so it's been amazing to be a part of that and to see, we've passed 15 state laws in
Yep.
just 3 or 4 years. Like you said, the goal 28 by 28, but really we have to pass 50 state laws plus a federal law. Um, and yeah, and I think there's so many skills that people develop through that process of like public speaking, organization, management, collaboration. You build networks. People express, clinicians and others express, more increased job satisfaction, increased engagement. So it's really great to hear about all of that. And just structurally, just so that everyone on the call knows, every state, I think we have, what is it, 46 states now with some
47
kind
now.
of
Yeah.
47 with some kind of activity. And so every state has a So Everybody Can Move coalition that you can become a part of. That core team is typically 5 to 7 members with a state lead. And then I help each group with the model legislation and to draft the law for their particular state. We work with legislators. So yeah, if anyone wants to get involved in that initiative, please let us know. Um, Adrian, what are your thoughts on tools available to build your advocacy
Oh,
skills?
absolutely. That's why I hopped off of mute when Kyle was talking because it's such a passion of mine. And when I think about this, because sometimes like I'm very extroverted, so I'm with with everyone going, but I think about sometimes how can we start even just with our clinicians, with our admins, educating students, doctors, community leaders, mayors, police officers, because sometimes it's as small as, I mean, I think everybody has seen the meme recently that a lady was issued a ticket for having her phone in her right hand, but she's an amputee and doesn't have a right hand, and so sometimes it's as small as that. And so my goal, and I think several others across the nation, is to educate even as small as through what is popped through ABC and understanding, okay, how can I do it? Not necessarily on maybe a large level, like so everybody can move, but something within my clinic, allowing students or prospective students to come visit my clinic to learn more about the field of prosthetics and orthotics, maybe even doing a show and tell at their elementary school, um, maybe STEM night, right? Those are great places to educate everyone about the field of orthotics and prosthetics. And so you're starting the students off even at K through 12 in terms of younger ages to learn about what is a prosthesis. Are there ones for your hands as well as your feet? Because sometimes all they think about is lower extremity. And so now we're giving them those education on the prosthetic side because most of the time they know that side. But hey, did you know there are also kids that really want run fast boots? Let me show you what a run fast boot is. It's called an AFO. It's an ankle foot orthosis. It allows their foot that may be a little off to allow them to walk and move and sit properly. And so then even at that small level at K through 12, you're educating students on what a future career path is for them for the future. And that is also advocacy in action.
Mm.
I think about one thing I did because I was like, oh, you think about like the state and federal level and they need education. What if you do it on your local level in terms of your mayor? And so our here in Georgia, the mayor has like a mayor day. And so, hey, is it okay if we have a table to teach the students or the entire community about prosthetics and orthotics? And so we had they have like a STEM whole day. And so here at KSU and other universities as well, take out all of their MSPO students to educate the community about it. And so if you can reach someone as small as your mayor, your police officers, your firemen, that, oh, I didn't even know this was a field. And now when they go and help someone at their home and realize like, oh, I have to make sure they grab their leg or grab their wheelchair or something additional in terms of assistive technology to make sure they're there. And so it doesn't always need to be loud, but I guess the best way to say this is when it happens on the small level, as your students, your doctors, your community leaders, your mayors, your police officers, it eventually will get to your state legislators, which will eventually get to your senators to say like, oh yeah, that mayor down in Smyrna, Georgia told me that you guys came. And that is how those kind of grassroots move. I had one of my students, because they were going to O&P school, said, hey, during our HOA meeting, I told them about the field of prosthetics and orthotics. And I said, absolutely, because you never know who, even at that HOA meeting, and that it matters to learn about our field. And that's what she learned. She said, oh, two of my neighbors 2 doors down told me that they have diabetes and they wear diabetic shoes and inserts. And it moved just even something as small as that. And so you never know where your impact will be
Mhm.
seen or heard, even at any level, because that is how you make it big, even at the small side.
I love that. Thank you. You're reminding me when you said HOA, because I live in a condo building and one of my neighbors wears an AFO. And, I
See?
noticed that, but I didn't really specifically say anything about it until we got to know each other. And then it naturally came up and I said, oh, I noticed that you wear this brace. Like how is it working for you? And we had a whole conversation and I eventually said I work at Hanger, and he ended up getting an exosim and
Oh, nice.
going
All
out. I live
right.
in Massachusetts. He went out to Washington State, got the whole thing, and he wears it and is experiencing, you know, easier, better mobility through that process. So yeah, like right. It can
Yes.
local is so impactful, and it builds upon itself to kind of the bigger picture. Which is a good segue because I was going to touch on state associations as well, and just kind of how that weaves into this conversation and how it supports so everybody can move. And so that is a big focus of mine, is wanting to make sure that as many folks as possible are involved in their state's state association. So not every state, but most states have what is known as an Orthotics and Prosthetics Association. And that is a state-based group, meaning that you have to file paperwork with your corporation's division of your state. And so that member association is only really in operation in that particular state. And so through that, clinicians, other O&P professionals, people with lived experience can advocate both to Medicaid officials and departments, as well as commercial payers and other entities, legislators within their own state about O&P access issues. So those are really useful resources that we often partner with so everybody can move on. So for example, if a state has a So Everybody Can Move coalition that wants to hire a lobbyist to help them shepherd the legislation through the process, that association has a particular IRS status known as 501c6, which enables it to collect funds for that lobbyist and pay that lobbyist. So that's a really important aspect of how, advocacy at the state level is hugely important, that we want to encourage professionals to get involved in their state association, or consider starting one. I know Mississippi, for example, I think Wisconsin also recently kind of revamped their state associations, elected new board members. And so they have, prioritization issues on their agenda that include So Everybody Can Move, maybe some coverage and policy issues through Medicaid. Sometimes we address administrative barriers through Medicaid, like the use of a certificate of medical necessity when it's not really needed. So these are all things that folks can work through their state association to change and to improve that access to care for people with lived experience. There are also academy chapters that work on advocacy, but those tend to be more regional, so cover multiple states at once. So they can't do as much direct advocacy to a particular state entity. But New York and New Jersey, for example, those academy chapters are state specific. So it's only for New Jersey and only for New York. So just wanted to add that in as well before we kind of move on to the next section. One other piece I wanted to note, which I think you had touched on, Brittany, is that, you can hear that each of us came to advocacy through our own unique paths based on a felt passion. So like Brittany, you were frustrated with the lack of access through specific payer policy issues and reimbursement. Kyle had personal experience with cancer and with wanting to make sure there was more research into that issue and more access to care that way. Adrienne had a family member who had lived experience and then got involved through her clinical work and now through her work as a professor. And I had personal experience, but also a legal background. And so a lot of the things that I do now, for So Everybody Can Move in particular, is kind of from the legal lens. So we encourage you to find your pathway in based on a passion of yours that's going to be lasting, because advocacy can be a long game. As we say, we're in it for the long haul. This is a career long endeavor. So back to you all on a question about what's a common misconception that people have about advocacy. So I'm going to start with you, Kyle.
Awesome. No, thanks, Maggie. When I often think about the misconception, it really comes down to there's this idea that I have to be a policy expert to advocate. I have to be this lifelong career to advocate. And when I think of what does it look like to be the advocate, you heard a lot about there's every different avenue to get into it. It just starts by questioning and being curious around why I notice that my patients aren't able to get access to A. I notice like my patients aren't able to experience B. And you start realizing there are things in place. There's policies, there's procedures, there's systems. And through that curiosity allows you to say, but does it have to be that way? I think advocacy really starts by actually questioning. Advocacy starts by saying, hey, I don't believe this is the right thing to do, and bringing people together to say, hey, is this the best outcome for our patients, and how can we build something better? And I think that's where I think about so everybody can move is, the question was always, why doesn't insurance cover more than one device? Why doesn't insurance cover a device for physical activity or back to work or to shower safely when we know, every single one of us know that one device cannot do everything? And why is it designed that way? And that questioning led to, oh, the insurance coverage and the policies are outdated. Okay, so if they're outdated, how can we fix that? Oh, how can we fix that? It's through legislation. And I think I just want to say it's the misconception is you have to have the answer. You have to be a policy expert. I think the where it starts is by willing to say, "Hey, I want to question the system. I want to help, and I'm willing to work with those that bring all the best minds together." I think about so everybody can move. It's a collaboration of a lot of experts. Every single person saying, hey, I'm really good at fiscal analysis. I'm really good at marketing. I'm really good at communications. I'm really good at building community. And it's bringing all of those together to work towards the common goal of solving the problem, which is passing the legislation. And then, after the legislation passes, how do we go out and educate our other clinicians about this new coverage? But I would like to say that you don't have to be a policy expert. Kudos to our friend Maggie, who has the JD, who is often our policy wizard when it comes to like reading the legislation itself. But I'll tell you, my expertise is how to mobilize people and how to rally communities. And I know that I lean on Maggie, like, hey Maggie, can you help me understand this part of the policy? I think I understand it, but from a legal terminology, can you help me? But it really is by willing just to show up and say, hey, this is my skill, this is my talent, I want to help.
Awesome. Thanks, Kyle. And I know I lean on you right back to help with mobilization and strategic partnership and fundraising. So yeah, it takes a village of all these different skill sets from everybody. In the interest of time, I'm going to kind of keep moving, and I wanted to shift over to you, Brittany, to ask about an example that you can share where advocacy directly improved access to care and how that benefited clinicians as well as people with lived experience.
Yeah. So as you guys know by now, like my passion is reimbursement and getting access to care for these patients from the reimbursement side of things and insurance. So when I was on the coding and reimbursement committee with AOPA, they actually had an initiative to change the LCD for knee orthoses, which is essentially Medicare's policy on how to get coverage, what requirements need to be met. And one of the biggest issues that patients and providers had across the country was that if a patient had osteoarthritis without a recent injury or surgery or without knee laxity, they couldn't get coverage for an OA knee brace from Medicare. And so there were a ton of physicians out there who were frustrated with this policy. There were obviously patients out there who were frustrated because at the end of the day, they would have to pay out of pocket for an OA, an osteoarthritis knee brace, even if they had osteoarthritis, just because they didn't have these other qualifications. So AOPA actually, the Coding and Reimbursement Committee drafted up a change to the policy and they recommended, hey, we think you should add another pathway for coverage. Here's all the research to back up why OA knee braces are really good in preventing issues down the road and needing surgery down the road. It can actually save money if they end up not needing surgery because the brace prevented that breakdown due to the OA. So they submitted it and the DME Max reviewed it. It took them 2 years and they finally got back to the committee and said, okay, we agree, we're going to change policy. So I believe that was last year, it might have been the year before now, time's going by so quickly. They updated that knee orthosis policy to now provide coverage for patients with osteoarthritis who don't have laxity or who haven't had a recent injury or surgery. And the interesting thing was, I was on the coding and reimbursement committee when they drafted that and submitted it. And shortly after, I joined OSER, and due to conflict of interest, I could no longer serve on that committee. But once I joined OSER, a big part of my role right when I started was working with physicians on signing advocacy letters and sending them into the DME Max, because we said, hey, AOPA wrote this letter. Now we want you guys to write in and basically say, we agree, we're advocating for this. So then I got to advocate on the other side with the manufacturer, trying to get physicians to rally behind it. And it was ultimately successful. Patients are now having access to this brace that they didn't previously. I know things are always really nice and sparkly around prosthetics, but there is stuff that goes on around the orthotic side as well, advocacy wise, that is really exciting. And again, we keep repeating it. It's the long haul. We had to sit there and wait, along with all the research that went into writing and drafting the update, we had to wait 2 years before hearing anything. And then we got the good news, and then it was advocating to providers of, hey, this is now changing, and updating them on that. So that was a really cool experience that I got to be a part of from all different sides. And when things are successful, it becomes very exciting and motivating, that's for sure.
Oh, absolutely. And then even just the implementation of it, right? So, okay, we have this in now. How do we sound off and let everyone know, hey guys, start billing for it? Because I know a lot of clinicians sometimes get like, oh, well, they didn't pay for it last year. So now every patient going forward, it's not available for. But no, there was a change in the policy.
Yeah.
So now how do we implement it and get the word out there? So absolutely, Brittany, that's wonderful.
Yes.
Yeah, great work, Brittany. And I'll just add to that kind of another example from the state side on the orthotic side as well. As one of the things we've been working on is the microprocessor KAFO code, the L 2006, and getting Medicaid programs to add that to coverage and policy. And so Maine, our friendly state of Maine, which was the first state to pass this so everybody can move law, we've gone back to them since then. We've asked them for an increase in the cranial remolding S1040 rate. We've asked them to add the microprocessor foot L 5973, and we've asked them to add the L 2006, and they have done all of those things. So, a wonderful state. Not every state is going to adopt all of those, everything right at once at the first time you ask, but we have to make the ask, and we have to show up and provide the evidence as to why these types of care are important and what they do and how they serve our patients in order to get those across the line.
But
Yeah.
you need that first state. You know what I mean? You need
Yeah.
that first
Yeah.
state to talk to, like to say, like, well, Maine was able to pass it. Let's talk about it here in Georgia. Let's talk about it here in Maryland. Let's talk about it here in
Yep.
Texas. Like you need that first state to take that leap.
And
Exactly.
Maggie, I think one of the things I wanted to kind of go back to from the beginning is really the system that we're in is broken. And it's just reality of way it is. But the thing is they were designed by people, and which
Mhm.
means they could be redesigned by people. And it takes us to be able to be involved in all of those different efforts, whether it's having Hill Days just to go educate lawmakers on the county level, the state level, the city level on what are prosthetics and orthotics? What are patients currently facing? What is the industry as itself? Like what is prosthetics or orthotics industry, and helping them understand the current policies that are impacted. Having just awareness days, really advocating on you have, April's Limb Loss and Limb Difference Awareness Month, and having community events where you invite the Department of Medicaid, you invite the insurance companies to come to a clinic and to see what you all are doing. Hosting mobility clinics in your local community for community members to access movement, and invite all of those decision makers that influence the policy, that are writing policies, that are making decisions, to come and just build a personal relationship. Because that's what's going to, this consistency and this all different levels of layers of advocacy is what's going to ultimately redesign the system for where it works really well for our clinicians, but also us as lived experience community members.
One thing I wanted to, because I'm always an action person, right? So Kyle, what you just stated in terms of invite them to those things, but what are you showing them when they're there? Because you're like, I don't have any materials, I don't know what to show. Guys, it's as easy as having a prosthesis on the table or having an orthosis on the table, or even just pamphlets and written material. So one great thing is ABC has provided us with whatispop.org, and you can download all of these things from free right from their kind of, they call it the sales team or from the sales thing, but it's free things that you can print out, or you can call ABC and the What It's Pop partner messaging team, and they will send it out to you in loads and loads to have at those tables, so that you can have something in your hand to be able to talk with someone about the field of prosthetics and orthotics, about advocacy, about this prosthesis, about this orthosis. And I always say, take a, whatever you have in your office, at home, that is its own um, material right there.
Yeah, and I wanted to actually, I was going to come over to you, Adrian, and just ask, for your students and for new clinicians, what do you see as the ways that advocacy builds professional skills? And maybe how can you use that to advocate for yourself, to your employer, perhaps, as to why you should be involved in advocacy? I think many employers see the value and understand it. But there are some still that, it does take time away potentially from patient care or other activities that you're doing. So, how do you make that pitch to your employer about, hey, this is not only going to benefit me, but our practice and the profession? Like, what do you say there?
And so, some things that I do share with my students is that same word, kind of awareness and advocacy. And while they are in school, they have a little bit more time to go out to these elementary schools, to go and advocate on main campus for undergrads to attend the graduate college. They have those things, but now they're in residency, and now they're seeing, 10, 16 patients a day, and now it's not the same. So even if it is small or there are ebbs and flows in your advocacy, it is still advocacy. And so ways that it's still part of what we're doing is even if you're doing an in-service. So ways to approach your employer is to say, can I do an in-service at a doctor's office to educate them about the policies that Brittany was talking about in terms of the new things that are now implemented, that we can now implement and get medical necessity, or for them to add into their note or whatever it may be. So maybe it's labeled as an in-service because it is to those doctors that may not know of all of the changes that are currently happening. It could be something as small as, hey, let's say you are in a smaller clinic, and there is something within your community like the birthday, right? So like maybe it's the birthday of the town or anything like that, and you have a table there, and maybe to your employer it's like, hey, do you mind if our clinic actually sponsors one of these tables, because all of our patients right here in our community are going to be at this birthday. We would love to tell them more about our clinic, our field, and all those things. And so those are different ways. It may be small, but those small acts really truly do matter. And understanding that it's not always the cheerleader in the back, or a cheerleader in the front. The person in the back is still pushing us still forward. So even with those ebbs and flows, like, or those small acts, it's still moving us toward our goal.
For sure. Yeah. And I think the same logic applies when you invite a legislator to your clinic because,
Yep.
your business, your practice, potentially you yourself are a member of their district. And so they have a direct interest. You don't even have to have like a particular issue or problem. You're just like, hey, come on down and see this business operating in your district. Learn what we do and how we serve the community. And that in itself is a great opportunity and segue. Brittany, anything you would add about particular skills, professional skills that you've developed through advocacy?
For me, it's just been really a good networking opportunity. I've met so many great advocates or just people in the industry through this. And I kind of mentioned it earlier, but when you go to like a national meeting, for example, I've been starting to talk to people who have a similar passion as I do with reimbursement, and I've been introduced in various ways to different people, including everybody on this call at one point. And it's so nice to talk to someone who shares that passion for advocacy. But I think the bigger thing is that I'm realizing is how important collaboration is. I do think our industry for a long time was very competitive. People kind of kept to themselves and they wanted their business to survive and thrive. And there was a competitor next door that they wanted the business from. So there was this kind of idea of kind of keeping to yourself and just pushing through. And I've seen a big shift in that over the last several years. And a lot of different competing companies have individuals coming together for the better of all of the patients as well as the businesses. And looking at these big things that, like, hey, if I fix this policy, yeah, we can work together. It's going to help you, but it's also going to help me, and it's ultimately going to help the patient, which is what's better. So for me, it's really allowed my whole career path to change direction and to flourish in a way that I never expected. My primary motivation for this job was something remote. Once I had kids, I wanted a little bit more flexibility. But it feels so much more at home for me what I'm doing day to day. And so much of my job is advocacy is just built in. I get issues left and right from providers and what they're dealing with, and I dive in, I learn about it, I help them through it, and then I say, hey, I've heard this 2 or 3 times. And then now I bring it to a committee where I say, this is a bigger issue. Let's try and work together to resolve it, because instead of hitting it one clinic at a time, let's just resolve it for the industry altogether. So yeah, it's really taken my career in a completely different direction that I absolutely love.
Excellent. Thank you so much. We're coming up on the end here, so I want to ask each of you to do like a 30-second to 1 minute spiel at the end here of, if you're a member of this audience and there's one key takeaway about how to get involved, what's the first step they can take? Maybe what's the first organization they should reach out to? Just with those things in mind, what is your advice for the audience? So I'm going to start with you, Kyle, if that's okay.
I love it. Yeah, the first step is would love to get you involved in so everybody can move in our state coalitions. As I shared from the beginning, you don't have to be an expert. I've seen clinicians that have gone from a full day of providing clinical care to that night going and testifying. And if they weren't there to testify and share their voice, the bill wouldn't have passed. And like it was their voice that really shaped and moved the hearts and minds of the legislators. And I think about the 100+ individuals that serve in our state legislatures. They're our neighbors, they're our peers. And our perspective and our lived experience, both lived experience as a healthcare professional and our lived experience as a community member, is what changes their hearts and minds and helps them understand like we can fix this. And I want to share with you, I want us all to be in a field where we don't have these problems anymore. And in 20, 30, 40 years, the future clinicians that are entering the same field as you, that join for the same reason, because deep down, all of us we want everyone to access mobility because we know how beautiful of a gift it is. And we have a system that works. And the only way that we're going to be able to do that is if we educate those that are designing the system, and to design it the way it should be, but also for us to raise our hand and help design the system, being on committees and serving on advisory panels, because that's how it's going to ultimately shape it. And so we'd love to invite you. We have 47 state coalitions. It's going to take all of us to convince hundreds and hundreds of legislators in every state to pass a So Everybody Can Move law. And so would love to get you involved. So you could visit soeverybodycanmove.org, click Get Involved, and we'll get you plugged into a state coalition right away.
Awesome. Thanks. Adrienne, how about you?
Oh, goodness. I guess my thing is to say, even if you start small, small acts matter. And really having even just one word or one phrase that gets the conversation started. And it may be just something as, do you know about prosthetics and orthotics? What do you know? What got you into the profession? Or it's sometimes just that small act. So regardless if it is um, to someone at a HOA meeting, which we just talked about, or if it's on a larger scale, just ask that question. And so similarly is what is POP?
Perfect. Thank you. And Brittany.
Yeah, mine is to just reflect on two things. What are you passionate about? And what are you good at? And use those things to your advantage because I think Kyle touched on it. It takes a village. You can't do it all. So if you can hone in on what you're good at and what you're passionate about, you'll be able to survive the long haul that you'll need to advocate. And just like Adrian said, start small, talk to an advocate, reach out to one of us if one of our stories touched you, or go to a national conference and start having conversations there. Look online at like AOPA and ABC, your state association. All of them have committees and they're all volunteer and you can sign up and, apply. That sometimes they'll have certain times of the year where you can apply. Other times it's just a rolling basis. So just start small, find out what you're passionate about, and then really dig into that and see where, because our field right now is on fire with advocacy, and there is something there for everybody to get involved.
Excellent.
I
Yeah, thank you.
Maggie, I think the one last thing is never stop questioning. Always be
Mm.
curious. And as if you deep down you want to provide the best care to your patient, if you learn that there's a challenge, there's a barrier to preventing you from providing that best quality care, question and bring it up and ask your manager, then ask, your company, and then bring it to AOPA because that's how we're going to eventually get to the point of building the system that we need.
Thank you all. Yeah, and I would just last plug from me is to get, as I think some of you said, get involved with your state association. Medicaid is in trouble right now, guys. We're facing cuts where we need to show up as O&P and make our voices heard as to why O&P coverage through Medicaid is so important. There are many healthcare groups out there making the same pitch, and so we need to do our part to show up for O&P and people with limb loss and limb difference. So that is certainly the end of we're a little bit over here. We're happy to stay on if anybody has any questions. Do we see anything from the audience? Okay, I'm not seeing anything. So I just want to thank our panelists again so much. It's so great to hear from you all and all the things that you're doing. I feel honored to get to work with you all on a regular basis. For the audience, please stay tuned for an email from AOPA. Be sure to check out the O&P Almanac for resources on today's webinar. And thank you again. Have a good day, everybody.
Bye, everybody. Thank you.